Hi, this is Dr. Bob Dannenhoffer, Public Health Officer for Douglas County, with another of our Facebook Lives. So tonight we've got some really good news, some slightly worrisome news, but I think overall things are good and getting better. And on such a beautiful spring day as today, everybody's hope needs to be up. So this is a chance for you to ask questions. We've already had a number of people put questions into Facebook questions at DouglasPublicHealthNetwork.org. So if you do that, we get a chance to go through them. And answer them in great detail. But you can also put them in the chat section and we'll get to them. Now, sometimes in the chat section, it's hard for Vanessa or Brian, who's putting these, to get them on the Facebook Live. So they don't always get it right. It is not their fault, it's mine. But I usually try and get back to people later. So as always, we start at the world view and then move down to the local view and tell you how we're doing. So at the world view, cases are coming down and deaths are coming down. And so I think overall in the world, it looks good. Especially it looks good in most of Europe. It looks good in almost all of Asia. It looks good in Africa. And it's looking better in North America. It is still pretty grim, however, in India and in South America. So South America, especially Colombia, Argentina, Uruguay, and Brazil, are having some of their worst times ever. Now, you remember their seasons are changed, so as our weather is getting towards summertime, they're getting towards wintertime, and with any respiratory virus, you would expect things to get worse, but they've been bad for a very long time, and that's a big worry. What's also a worry is when you look in those areas, they're almost all variants there, mostly the P1 variant. Now they have the P2 variant, and the P1 and the P2 variants are concerning. But that's South America very concerning. India is concerning. It's a little hard to know what's really going on in India. There are stories that it's so overwhelmed right now by the amount of disease that they're having that they're unable to keep up with testing, that they're very unable to keep up with the numbers. There were some stories in this last week about many bodies being either buried in makeshift graves or thrown into the rivers and then floating down the rivers. Truly must be an horrific sight. So that's the worry in the world. But for the most part, most of the world is doing well. In the U.S., similarly, most of the country is doing well. I think at this point, there are nothing that I would call a hotspot. Almost all the places in the country are pretty cool. Michigan and Minnesota, which had a lot of cases, have quieted down. Florida still has more than its share, but is not particularly hot. And then there are some places that have very little disease. So overall, things are looking good. In Oregon, we did have clearly a fourth spike, but our cases are now coming down. Hospitalizations in Oregon are coming down, and our deaths in this time have been relatively low. Still a lot of disease, though, in Deschutes and Klamath County. So when we talk about the amount of disease, cases per 100,000 per day is kind of the thing we use. And again, Douglas County between 8 and 10 cases per 100,000 per day, but Deschutes and Klamath are at 34 and 37 cases per 100,000 per day, and they've been there for a few weeks now, so lots and lots of disease there. In Douglas County, our case counts have been up and down, some days low, some days high, but averaging about 9 or 10 a day. But the thing that's worrisome in Douglas County is the number of hospitalizations. There are 18 people in the hospital today with COVID. 18 people in the hospital with COVID. That is stunning. You know, we had that before in the wintertime when we had many cases. Now we're having it with fewer cases. The other thing we're seeing is most of these people being hospitalized are young people. So when I look today, there are only 2 that are older than me. So I use myself as sort of the benchmark here. 2 are older than me. The others are younger. Now, early on in this, when we looked in the pandemic, it was the other way around. If we had 15 people in the hospital, 13 would be older than me and 2 would be younger. So it was rare to have somebody under 60 or under 65 in the hospital. And now almost all of our hospitalizations are in younger people. Some of these people are really very sick. And I was talking with the person from OHSU today, and they're out of this ECMO. So there's 1 ECMO bed in the entire Northwest up at Seattle. So ECMO is this heart-lung machine thing that's used for people who are very sick, and there's 1 left in the entire in the entire region. So that's worrisome. So the good news, overall, I think disease is down. The bad news is the hospitalizations are funny, and especially hospitalizations in young people. The other good news is vaccinations continue at a brisk rate. We'll talk a lot about that today. So vaccinations are continuing at a very brisk rate. I think Oregon overall is doing well, and I think Douglas County is doing well, and we'll go into great detail to explain that. The bad news, the good news is that the vaccines, some data this week suggest that the vaccines work well against the B117 variant. They work reasonably well against the 351, which is the South African variant. We're still a little less clear about how they're going to work against the P1 variant. It's still a little unclear about how it's going to work against the Indian variant, which is the 617. Okay, let's go through the questions. Put your questions in here, and we've got a bunch more things to go through. So once a person has recovered from COVID, what exercises are recommended to assist in getting strength and endurance back? So in people who have had COVID, many report that it's many, many months until they get back the level of strength and endurance that they'd had before. Early on, it was mostly older people, and strength and endurance in older people is a tough spot. But now that we're seeing younger people, we have a number of younger people who have really reported tremendous difficulties in getting back. So, for example, there's a young woman from Lane County who was a collegiate runner. I mean, if you take anybody, sort of the most fit people out there, I think a collegiate middle distance runner is probably it. And she was so sick that she would get short of breath walking to the kitchen table. I understand several months later she's continuing to slowly recover. Certainly not at the range of running at college, but she is slowly recovering. So the recommendations have been, there are no specific recommendations from COVID. There are recommendations for people recovering from these illnesses, and it's slow, steady, keep at it. So typically in people getting their strength and endurance back, walking is a first great step. And then moving up to walking longer, walking faster, maybe walking hills to get it back. So who do we email at the state to get an answer on why other vaccination sources are not counted in the county tallies? Douglas County is going to be treated unfairly regarding restrictions on all those VA, Cow Creek, and other vaccinations are not noted in the county vaccination scheme. So Commissioner Freeman and I have spent innumerable hours over the last 2 weeks working on this. So let me go back to what the problem is. So the problem is that for most of the state that do not have federal facilities, all of the vaccines are recorded into our alert registry system, which is called Oregon Immunization Alert. 4 million or so vaccines, but there are about 100,000 vaccines that are federal vaccines. So in the 4 million that the state gives, 100,000 is kind of a rounding error. But in Douglas County, we think it is about 12,000 out of a total of 50,000 people vaccinated here in Douglas County. And so the reason for that is that the VA and the Cow Creek get their vaccines from the feds, and then they report it back to the feds. The way they report it back to the feds is different than the way Oregon reports it. And so the numbers that the feds they can't easily be mixed. And so it's a big problem. And I've been working with the head people at the state about this, and it's not that they don't understand it. So let me tell you where we are on this. So these numbers that we need to get to go to lower things will count the VA and the Cow Creek numbers. So we negotiated this last week that those vaccines, which we think are about 88,014 about at the VA and 3,034 at the tribe. So 8,814 at the VA, 3,034 at the tribe will get counted in the Douglas County numbers. And so they will when it comes to restrictions. We don't know how it's going to be the 70% that the state has to have to get there. I'm not sure how that's going to work, but at least for our local numbers, they will get counted. And when you count those numbers, I just spent a lot of time on this today. And when we count the numbers are there are 35,799 people who've had one dose of Pfizer, Moderna, or the single dose of J&J, 35,799, which is almost exactly what the state gets. The VA is given, as I said, 8,814. The tribe is given 3,034. When you add those together, you get 40,674. The relevant population is those people 16 and above. That relevant population in Douglas County as of last month is 94,814. So when you put those together, we're at about 50.2%. So about 50.2%. So we're there. We're getting there. And we're similar to the other counties around us. And if we continue with this rate, we'll get up to that 65% about the same time as the counties around us. So I think we have pretty much straightened it out. The one problem is that OHA thing that shows the map and the counties with the different things, there's not an easy way for them to correct that. What we asked today is that what we're asking them to do is just put an asterisk on Douglas County, and there's two other counties that are in the same ballpark. Put an asterisk there that says, these number of recorders only alert things and may undercount federal things. Talk to your local public health authority for the correct numbers, and we'll give them to you. And that's why we think we're at about 50.2%. So we're going to come up with some graphics that'll help us to understand. So we're at 50.2% now. 65% is when we can move to the low range, and at 70% for the state, we can get to a point where the state's going to get rid of pretty much all the restrictions. That should be our goal. So to get to 65%, which is what we need to get to the low range, we need about another 14,000. It's actually a little less than that now. Vaccine, because we did some this weekend. So it's about 13,000 some odd vaccines. We can do that. You know, we did 585 this weekend, so we'll get there. We just need people to get the vaccines. Now, some of the people who haven't gotten vaccines, some of the people have been getting vaccines, just haven't gotten around to it. So we're looking at the people who haven't got vaccines yet, and there are a couple of things. There's some people like, nope, never, don't want to get that. I'm not sure we're going to convince them. There's another group of people who are like, well, let's wait until the FDA does final approval and then I'll get it, or I want to see 6 months of data. We're getting very close to that in this next month. So hopefully those people will come on board in the next month. And then the group that we're really working on now is people who just haven't gotten it to it yet. So if you heard this before, bear with me. So there are a lot of things we ask people to do in medicine, and they don't hop right to it, right? We tell people when they turn 50, you should go get your colonoscopy. But I will tell you, there are not a lot of people who line up at 50 to get their colonoscopy. They need to get pushed a little bit. And so most people don't get their first colonoscopy until they're 51 or 52, when their doctor says for the second or third time, hey, you're going to get that colonoscopy, Bob? And then you wind up getting it. So similarly with this, I think there are some people this isn't top of mind, and they haven't gotten into it. And so we're going to just gently cajole those people. We're going to make it easy for them to get it. We're going to try and make it a little bit fun for them to get it. We're going to try and allay fears. And we think there's probably 10 or 12,000 of those people. So we think we can get those 10 or 12,000 people if we can do it. And so we're going to continue to do events at the fairgrounds. We're doing a big event at Aviva this weekend. Our Tiger team is out there every day. They're going to be tomorrow. Today they were in Azalea and Glendale. The rest of the week they're going to be around the county. If you want the Tiger team to come to your place to give vaccines to people, that'll be great. So that's what we're going to be working on. If our goal is to get another 14,000 vaccinations by the end of June, which should be our goal, it's 300 or 400 new people a day. That's not undoable. So we'll get it. So Paul, the good news is we've been working on this. Unfortunately, all the time we've spent on this has been time we haven't been doing other things. But Commissioner Freeman and I have been like white on rice. So I was on a meeting this morning with the governor, and Pat Allen was there first, and he and I got on a few minutes early. He said, Bob, what can I do to make this better? And so we talked about that this morning. So a lot of videos on Instagram about magnets sticking to people's arms where they were vaccinated. I tried it myself, and it was and it was disturbing to see it actually sticking to most who had been vaccinated. So there's nothing magnetic in these, and this has been tried by other people in a sort of a scientific way, and it doesn't seem to be right. So I really would like to go ahead and do this, to try this out. I mean, the vaccine itself doesn't stick to the vaccine. There's nothing magnetic in it. So I don't know what to make of this, but what I've heard is that when scientists have done this, it doesn't stick. So, yeah, I've seen those videos, but I've seen lots of crazy videos on YouTube, and I don't know what it means. So we're going to check this with people who had Pfizer, and one of the ways to know is we will go in not knowing which arm the Pfizer was in, and we'll try putting magnets on both arms and see, and then later we'll reveal which arm it was in and see if there's a difference. So Diana says, I just got done with an antibiotic for 5 days. How soon should I get the vaccine? So antibiotics are not a contraindication of getting the vaccine. You should get it when you're feeling well. So Holly says, I'm vaccinated fully and want to visit my 90-year-old grandmother or 90-year-old mother who refuses to be tested. Is it safe to see her? So in the whole scheme of things, from very unsafe to safe, this is more on the safe side. If you're fully vaccinated, and your 90-year-old grandmother is not out having lots of other contacts, her risk of having the disease is low and your risk of having the disease is low. So we would think that would be okay. Now, it'd be obviously safer if she would get the vaccine. Not quite sure why she refuses the vaccine. The vaccine has been shown to be incredibly safe and effective in older people. So Veronica says, do you think the increase in hospitalizations is because there are more cases in Douglas County and they just aren't being tested? So the theory for why there are so many hospitalizations are several. So one is, no, there really aren't 14 new cases. There's really 100 new cases a day and you're missing just because you're not testing people. We don't think that is correct, because if that was correct, what you'd see is an increased number of cases and people were getting screening tests. We're not seeing that. You'd see an increased positivity rate. We're not seeing that. And you'd see a lot of other people who were sick but kind of hiding it, but they would be sick and showing up at places like urgent cares or other places. We've not seen any of that, so we don't think it's that. Actually, what I do think is that there is a fair amount of disease out there, and it's almost all the variant. And as we talk to places, other places in the world, the variants seem to affect younger people more than the older forms did. Now, it doesn't mean that they predominantly get younger people, but just in a higher percentage and sicker than they did before. So if you look at some of the news stories and some of the reports by doctors in the UK and South Africa when their variant started, so the B117 in the UK and the 351 in South Africa, what they were noting is that, oh my goodness, we're seeing a lot more disease and a lot more hospitalizations in young people. So it's probably a deal with the variant much more than that. So Nana says, I've had COVID, why do I need a mask? So I've had a couple of calls and comments today about this. So if people who are vaccinated don't need a mask, why do people who've had disease still need a mask? Still had disease but not gotten vaccinated still need a mask? Some of this is just splitting hairs. So we do know that people who are vaccinated typically have about 90% protection against infection, not 100%. And that's why some purists think that this getting rid of masks for fully vaccinated people was a little early. We know that people who have had the disease before have about 80% protection in the first 6 months after the disease. Not that much different from vaccination. So looking at the science, you have to make the break somewhere, right? You have to make the break at some point, and CDC, who makes these rules, made the break at having had the disease, still need to wear a mask, and having had a vaccine, not to use a mask. I think it's a tough call. you'd have to decide one way or another, and unfortunately they decided that way. I had another call today that's suggesting that there's a lot of background immunity there. I don't think that's true. So when they've done some really high quality immunity studies, what they find is they find what percentage of the community has antibodies, and it varies between different states. And typically, when you look at the variations between states, it really reflects how much disease they've had before. So, for example, if you look in New York, about 20 some odd percent of the people in New York have antibodies in New York City, especially in Bronx and Brooklyn, because they had so much disease back there in the springtime. If you look at places like Vermont and New Hampshire, where they've had less disease, they have low rates. And when you look in Oregon overall, it's about 6%, between 6 and 7% of the people, when you look at blood samples, have antibodies. When you look, the other way they look at it is Red Cross does antibody tests every time you donate blood, and they look to see how many people have immunity, and they have a way of splitting immunity from having had the disease versus having had the vaccine, and the number of people have had immunity from the disease has been around 6%. That number is not surprising, right? That would suggest in Douglas County that about 7,000 people would have had the disease. We know about 3,000 of them, so that we somehow didn't find 3,000 people either had asymptomatic disease or had disease before we had testing, whatever, all sort of makes sense. So all those numbers kind of go together. So all those numbers kind of go together. So it's a tough one to know how you figure in immunity from people who've had the disease. We know that people who've had the disease have pretty good immunity. Recent studies that came out suggest that immunity lasts a while. It does seem to dip with time, and it's not clear whether within a year or a year and a half or 2 years or 5 years it's going to dip below the level where you'll have protection. So are the hospitalizations here related to COVID? So they're all related to COVID, but are they from which variant are they from? So again, the variant analysis we get is usually late, so you usually don't get it until people are well out of the hospital, because it takes a long time to do these tests. So I know people are anxious and think, what CSI or something or NCIS, that they put the sample in and a minute later they have the full genome. That's not really how it works. It really takes a long time. So it takes about a week or so to get the genome, even from this virus. A human genome obviously takes longer. But what we have seen is that the variants are here. So there is some B117, there is some P1, there's some of the Southern Californians, the 427s. We've not seen any of the 351, which is a South African, or the 617, which is the Brazilian. There's a nasty outbreak of P1 going on, multi-counties. And I think I talked about this on Friday, but a multi-county P1 outbreak. And so we'll see. So there are a lot of hospitalizations. Well, there are no questions in there about the masks, and this is the thing that is so freaking confusing. So you'll remember, starting last spring, there was a recommendation that Oregonians wear masks both inside and outside, and in many different situations. You remember that I said, well, masks indoors make a lot of sense. Masks outdoors, especially if you're out in the wild blue, really are not that useful. And so we've pared back, and the CDC came up with guidance last Thursday about using masks. And what it suggested was that people who are fully vaccinated do not need to wear a mask indoors or outdoors, except in limited circumstances, like if you're in an airport, if you're at a healthcare facility, if you're on a train or something like that, then you should wear a mask. But otherwise, fully vaccinated people did not need to wear a mask and don't need to wear a mask outside. The problem was, how do you decide who's vaccinated and who's not? And that's going to be a really, really, really tough one. That's going to be a really tough one. I just cannot imagine how businesses are going to know if people are vaccinated or not vaccinated. I mean, you could certainly use people's the honor system, but there's so much stuff going on with this. I'm not sure that there are going to be people who might not exaggerate their immune status. I don't know what's going to happen. What should we do? So if I was in charge, what should we do? Is that anytime we're indoors, and you can wear a mask. It's not that hard to do, and it may give some protection. Does it give a lot of protection? It's not magic. I mean, no one suggested, I hope, that masks alone were going to fix this. Because masks alone wouldn't fix this, but masks were one of the tools. Distancing is one of the tools. Staying home when you're sick is one of the tools, and you put all those tools together, and they all help to decrease your risk of disease. Now, when we look at the power of reducing disease, far and away, without a doubt, the most effective thing is getting a vaccine. Because again, we talked last Friday about 60 consecutive cases, none had been vaccinated. We had another 30 or so since then, none had been vaccinated. And among all those people who've been vaccinated, and there are a lot of us who've been vaccinated, no cases. And so the data is getting increasingly clear that vaccination is very effective, at least 90% effective, maybe even more, whereas masking might have been a few percent effective, closing down restaurants maybe a few percent effective, social distancing probably a little bit more effective, staying home when you're sick effective, but that's what we had. It's all that we had back then, and we had to use every tool at our disposal, so we used even weak tools. So somebody made an analogy. They said, well, if you're out camping and all you have is two sticks, you use that, or if you have to rub sticks with each other to make fire, you do that because that's all you have. But as soon as somebody gives you matches, you don't go back to using that old stuff. And so similarly, back last year, all we had was flint and things like that. We did not have very strong tools. Now we get the vaccine, which are like hurricane matches. It works great, easy to use, works great. And so with that, you probably can get rid of some of the less effective stuff. So Veronica says, I've heard people say that it's against HIPAA to ask if somebody is vaccinated. So HIPAA is a complicated rule about privacy. And it is a complicated rule that affects insurance transactions in that. Vaccines in and of themselves are public health measures, and they are not considered to be HIPAA violations. So talk about that. Now, if you talk about the payment for HIPAA violation, the payment for vaccines, it could be, but again, it's not going to be a HIPAA violation to do that. In fact, we collect all the time other kids' vaccine stuff for schools. We collect people's vaccine status for the military. We collect people's vaccine status if you want to travel to places in the world where you need certain vaccines. So we could do this. So yes, we could get people's vaccine status, but I'm not sure the right way to do this. So New York has a deal called the Empire Pass, where you sign up voluntarily, and then it figures out your vaccine status, puts it in a QR code, and then on the QR code you can go ahead and make this work. So should we still require masks for an outdoor farmer's market? No. So I don't think outdoors masks are required for anyone. I think that came out today. So I think outdoor masking is not required, except if you're going to be in a crowded situation. So if you're going to be in a crowded situation, let's say you're outdoors but are waiting in a long, close line for the bathroom or something like that, then you might want to put on a mask. So I usually bring a mask with me when I'm outdoors, but I don't wear it very often because you don't need to wear it very often. Okay, so this is time for you to get questions. So a couple other things that came out today. One is you may remember that early on there were a tremendous number of outbreaks at the Department of Corrections in Oregon. So at one point, almost all of the Department of Correction facilities had outbreaks. And with those outbreaks, a lot of people were getting sick. And with those outbreaks, sadly, a number of people in corrections died because of COVID. Early on then, in the 1A group, in the early group, people in the State Department of Corrections were vaccinated, and that was controversial at the time. But what we've seen is that they've gotten their vaccination rate up to about 70%, and when they've gotten their vaccination rate up to 70%, that these outbreaks in the state correctional facilities have nearly gone away. So it just is remarkable where there had been dozens of outbreaks before there was one outbreak left in the group, which is really pretty amazing. Some questions came up about the safety of the J&J. Most recent, there have been 28 cases of blood clots and 3 deaths. So 8 million vaccines, 28 cases of blood clots and 3 deaths. Still you don't want to have any deaths, but that's still pretty remarkable. And new studies suggesting that the vaccines still seem to work very well against the B117 and the 526, which was sort of the New York variant, a little less against the 351, and still not exactly clear against the P1 and the P2, the 6171, which is the Indian variant, and the 6172, which is the one that's now circulating in India. So the 6172 is rapidly increasing in India. The problem with that is that's got a lot of mutations in it, and it has like the worst mutations of the B117 plus new ones. So we don't really know what's going to happen with that. That's the big worry, right? That we get everybody vaccinated. We think we're doing great. We have a low number of cases. Then the 617 gets into a population and it laughs at the vaccine, and even the people who are vaccinated get it. So that's a worry. But again, India is the big concern. A lot of people close together, lots of transmission, and lots of opportunity for this virus to mutate. Still no questions about the masks. So the questions about masks for an outdoor farmers market. Yes, we should certainly do that. Other people asked about testing, and so the story on testing is that testing is widely available. Really, anybody with symptoms suggestive of COVID should get tested. One of the things that we have seen recently is people having other symptoms for a couple of days, not knowing what those symptoms were, going to work, still doing things, and then 2 or 3 days into it developing a very particular symptom like loss of sense of taste or fever. And then what's happening, what is happening is that they've now given it to all of these people in those first few days. So the recommendation still should be, if you're feeling sick and you're not sure why you're feeling sick, you should really stay home. And if you're still feeling sick after a day or two, then you should get tested. And I know we really in this country want to go to work, even if you're a little bit sick, and be macho man, but I don't think we should do it. So Janice says, what about underlying conditions like diabetes that have been fully vaccinated? Should they still wear a mask? So the story is, if you're fully vaccinated, you do not have to wear a mask, but should you? There was an article in the New York Times today about people who were saying, well, it's my choice if I want to wear a mask or not. And although I have 90 or 95% protection from the vaccine, I'd like to wear a mask because it makes me feel more comfortable. And again, we as a society should sort of allow that. They're not certainly causing any harm to anybody else, and so they do it. So should they still wear a mask? The answer is if they want to. So if they still want to wear a mask, go for it. Now, are we going to change what we do with masks? We might. This was a remarkable year. I saw a kid today, and the story was he might have an ear infection, and it was like, whoa, this would be great. I haven't seen a kid with an ear infection in weeks, and we've only seen like 2 the whole winter, because kids really did not get very sick because of the other kinds of things that we did that really decreased the number of diseases. And so will we do masks again next year? I don't know. But we've seen other things that happened during the pandemic that were interesting. So early on in the pandemic, we had a real decrease in the amount of prematurity, that is premature births. And we still don't fully understand that. It may be that in the early parts of the pandemic, when things were locked down, people didn't have to go to work, they tended to sleep about 1 hour more than they did pre-pandemic and they do now. So Americans seem to be chronically undersleeping by an hour or so. And during the pandemic, when they didn't have to get up. They typically slept 1 hour more than they did previously. And when they saw what that is, that the amount of prematurity really dropped. And we're not sure if the drop in prematurity was related to better sleep, but it may well have been. And so we're learning all kinds of little interesting things from the pandemic about this. Okay, well, that may be it for questions, which is a good thing. The goal is, how is this going to end? The hope is that as we get more and more people vaccinated, we'll have less and less disease, we'll have fewer and fewer cases, and we'll have fewer cases, and then it's going to fade into the background. Will it go away? I don't think so. With this world having international travel, there's going to be a hotspot, and there's going to be somebody traveling either from or through a hotspot and bringing the disease in. So kind of like in the beginning, where our first cases were people who had traveled to Japan or traveled to Australia or New Zealand and then came back. We're still going to have that, right? We're still going to have the traveler who went to Africa or went to India or something and bring it back. But it's going to be relatively small. We won't need to have the big task force. We won't need to have all these other things. So that's my hope. And when we get there, I don't know. I would hope by this fall. So Veronica says, why are our clinics still not testing when you go in sick? So we ask them every week. So twice a week we have a meeting with all of the clinics, and we're asking them to test. The tests are free, zero cost. We provide them to the clinics. Now, obviously, they cost something to make along the way, but the feds paid for them, gave them to the states, the state gave them to us, and we give them out to the clinics. So they are free to the clinics. It doesn't cost them a penny. And I don't know why. I talk with the clinics all the time. I was corresponding with one of the clinics today about how they were testing and doing quarantine. And they seem to be doing it right. So, Veronica, if you can send me in the chat which clinic you think is not adequately testing, let me know, and I'll talk with them about that, because I do think that they're testing. We're certainly seeing lots of tests every day, but if you know of some clinic that isn't testing sick people, that's wrong, because again, early on, this disease is really, really hard to distinguish from other things. So, somebody today with abdominal pain for a few days, and then they had lost the sense of smell and taste. We had somebody else who had what they thought was allergies for a few days, and then they started with a cough and a fever, and they turned out they had it. So early on, the first 2 days, I think the symptoms are really, really hard to pick up. And thus, if you're sick enough to go in to get tested, to be seen, you should certainly get tested. And again, the tests are so much easier than they were before. Remember, early on, they were these tests that go deep in your nose. Really, really disgusting. I've had them done a number of times when I was showing other people how to do them. Ugh, they are gross. But now the test is just in the front part of the nose, like what you would do with a Q-tip in the nose. So it's very easy now, and they're about 15 minutes, and they're really remarkably accurate. So I think if you're sick, you should go in. The doctor doesn't want to test you, say, ooh, that Dr. Bob says, with these symptoms, could you humor me and do a COVID test? And then if the test is negative, then you can move on to the other things. All right, well, that looks like it for questions, which is great. What I want to tell people is we're making great progress on the vaccinations. If you or somebody in your family is sort of that medical procrastinator kind of person that wants to get the vaccine but just hasn't gotten around to it, there's lots of places to get the vaccine. Almost all the pharmacies in town have it. Almost all of the clinics have it. We're going to do another event in 2.5 weeks at the fairgrounds. Just give us a call. We'll come. We want to get it done. We really want to bring these numbers up to the point where we can get enough people vaccinated so we can open things up. Because once we get to 65% and do this equity plan thing, really all those other restrictions are gone. So if people want to get rid of the restrictions, the best way to do is to get everybody vaccinated. And it's easy to do because right now we've got plenty of safe and effective vaccine. The one thing we're going to do here is we're going to actually do the scientific study on the magnets. And the way to do it is we're going to find 10 people, probably won't take more than that. We'll get a super strong magnet. We'll see if the magnet sticks to one arm or the other, and then we will break the code and find out which arm they got this in. I have not seen that anywhere on on YouTube. So we'll take a look, and we'll actually do the study. So again, look for the study, and we'll do that in the next few days. Again, this is Bob Dannenhoffer, Public Health Officer, Douglas County. See you again on Friday, 4 o'clock. Thanks.